In the following example, a student nurse works with his clinical preceptor to determine a short-term plan for his patient. During this example, you will have a chance to review the 3 types of contexts present in the situation and the foundational knowledge needed to make clinical decisions.
Hi Lisa, I just finished my assessment with Mrs. James and I was hoping I could review my plan of care with you before I finalize it.
Good morning, Paul. It is nice to see you here right on time and taking the initiative to check in on the new patients. And it's great to see that you remembered to wear your name tag and a clean uniform. You are ready to face the day. So what was it that you wanted to ask me?
Thanks for noticing. Well, Mrs. James is a 62-year-old woman who came into the hospital today complaining about increasing fatigue, swelling in her hands and feet, and labored breathing. She had an anterior myocardial infarction 2 years ago, and when I spoke to her, she seemed restless, pale, short of breath, and also mildly diaphoretic.
Okay, it seems like you observed most of her symptoms. What were her vital signs?
Well, she had respiratory rate 34 per minute, BP 102/60, pulse 104, O2 sat 89%, temp 37.2.
So what are your thoughts at this time about your next steps?
Well, based on these findings, I think the plan should be to assess her chest sounds to determine if she has pulmonary edema. And if she does, I will need to position her upright like I was taught to enhance her lung capacity and then to apply oxygen. Although it doesn't look like there's anything serious, I'm going to check with her physician about orders for a diuretic. And I think that should take care of Mrs. James and we can let her go home.
Well, it sounds like you did everything you needed to do and are doing your assessments as you've been instructed. But before we can let her go home, there are still some more things that we need to find out from Mrs. James. Why don't we talk about these strategies for a minute, and then you can complete your interview with Mrs. James and we can develop a discharge plan that gets her home as soon as possible. So what kinds of things do you think we better find out about Mrs. James before we send her home?
I guess right now I don't know anything about her situation at home. I think I better go back and talk to her and get some more details about how her home is set up and what kinds of support she has there. Hi again, Mrs. James. You know, I realize that I didn't ask you about your house. I know you really want to go home, but I want to make sure you are safe when you get there. So tell me a little bit about who lives with you and where the bathrooms are in your house.
Oh, I live in a lovely old big house all on my own. It's an awful lot of space for just one person, but I love my home. And after my husband passed on, I decided to stay there. There's only one bathroom at home, and it's on the second floor where the bedrooms are.
How many stairs to get to your bedroom and bathroom?
Oh, about 13 steps altogether.
And when you're home, where do you spend most of your time?
Well, in general, I stay on the main level most of the day and only go upstairs to use the bathroom and to go to bed at night. I get enough exercise, though, climbing those stairs probably 6 or 7 times a day to use the bathroom.
And would you agree that right now you're pretty short of breath when you walk too much or have to climb stairs?
Oh, that's true, but I'm already feeling better compared to this morning, and I really want to go back home to my own bed and everything.
Okay, well, I will be back after I talk to my preceptor, and we can discuss our recommendations with you then. See you a bit later on, Mrs. James. Hi, Lisa. I am so glad that I went back to see Mrs. James. I think we need to keep her here in the hospital until she is completely better because she lives entirely on her own and she has so many stairs to get to her bathroom. I am really worried about her. You know, people who live on their own should not be discharged home until there are no more symptoms and until we are absolutely sure they have recovered.
It sounds like you are really concerned about Mrs. James being sent home too soon. I think you got some very important information to help us decide on a better discharge plan for her, and I agree that it is too soon to send her home today. But do you think it is realistic that we keep her here until every last one of her symptoms is cleared up? I'm curious about why you feel so strongly about this.
I suppose I am reacting a little strongly now that I know Mrs. James lives on her own. But last year my grandmother was discharged home 2 days after a heart attack, and she lived alone too. She had a second heart attack a couple of nights after she was discharged home and died by herself. It looked like she was trying to get to the phone, and I can't help thinking that if there was someone else there, they may have been able to get help to her in time. Or if they would have kept her at the hospital till she was stronger, she would have been safe. I wouldn't want anything to happen to Mrs. James. But now that I'm talking about it, I do realize that their cases are not the same. I think I need to step back a little and look at her symptoms and talk to the rest of the team about a discharge plan that is reasonable and based on her specific case.